Hello, so today we're going to be doing the elbow eval. First part is going to be history. It's going to be past history and present history. Inspection is going to be swelling, discoloration, deformity, muscle contour, and carrying angle. Next we're going to do palpation, bony. We're looking at the shaft of the humerus, looking for fracture. Looking at the medial condyle and epicondyle, looking for fracture and tendinitis. Looking at the lateral condyle and epicondyle, looking for fracture and tendinitis. Then looking at the olecranon process of the ulna, looking for fracture and bursitis. Then looking at the shaft of the ulna, looking for fracture, and looking at the head and shaft of the radius, looking for fracture. Then we're going to move on to our soft tissue. It's going to be looking at the bicep brachii. It's going to be looking at the long head and short head, looking for tendinitis and strain. Then you're going to be looking at the tricep brachii. You're looking at the long head, lateral head, and medial head, looking for strain. Then we're going to move on to the finger and wrist flexors, starting from the medial epicondyle, looking for strain. Then looking at the finger and wrist extensors, starting from the lateral epicondyle, and then looking for strain and tendinitis. Then we're going to move on to the brachioradialis, looking for strain. Looking at the brachialis, looking for strain. And then looking at the anconus, looking for strain. And then you'll be looking at the ulnar collateral ligament, looking for sprain. Radial collateral ligament, looking for sprain. Looking at the ulnar nerve, looking for entrapment and palsy. And then looking at the annular ligament, looking for sprain for that. Then we move into our stress test. Our first stress test is going to be the valgus stress test, which is testing for the ulnar collateral ligament. Get the arm out straight, just like that. And then the varus stress test is going to be testing the radial collateral ligament, like that. Then we move on to our special test. Our first special test is going to be the tennis elbow test, which is testing for the lateral epicondyle. So you're going to have the patient sitting down, elbow tight to their side. And you're going to tell the patient to make a fist and to face it down. And then you're going to be palpating the lateral epicondyle while they resist wrist flexion. And make sure that they're not doing elbow flexion. It's stationary and that they're only moving the wrist. So make sure that you're resisting down. And you should be trying to see if they have any pain. The next test is going to be the Tinel sign. This one's testing for ulnar nerve entrapment. So you're just going to be poking on the ulnar nerve. Any pain would be a positive. Then the next test is going to be the handshake grip test. So you just have them and then tell them to squeeze your hand. And this is testing for the medial collateral ligament. Then we move on to our range of motion. You do active and passive range of motion. I'll be doing active range of motion today. So you have elbow flexion, elbow extension, forearm pronation, and forearm supination. Perfect. Then our next test is going to be our resistant range of motion. This is our muscular strength testing, but which is our resistive range of motion. So the first test is going to be elbow flexion. So to test for the brachialis, you have them resist down and put up. That's going to be that one's going to be your bicep brachii. And then you rotate it like that and have them go up. And that's going to be your brachioradialis, and then have them face down and resist. And that's going to be your brachialis. That is going to be your musculocutaneous and radial nerve. And then you're going to do elbow extension to have them resist down, so resist on them. And that's going to be your tricep brachii and your anconus. And that is your radial nerve as well. Then we have forearm pronation, so have them pronate as you resist on them. Like that. That's going to be your pronator teres and your pronator quadratus. And then have them resist supination. like that, and then that's going to be a supinator. and that is going to be your radial nerve. And then we're going to go on to our neurological testing. So it'll be the motor, so you're just going to have them perform the same action as you do. So you have C5 deltoid, C6 wrist extension, C7 tricep extension, tricep flexion, and then wrist flexion, and then finger extension. Then it's going to be C8 finger flexion, and then T1 finger abduction, finger adduction. Then we move on to sensory. So we have C5, C6, C7. Then we move on to our reflexes, which is tricep. Then we move on to our blood flow test. We have radial pulse, recapitalization, and then Allen's test. Other arm like that. Looking towards you. Okay, and then you bilaterally compare.